Women have breast reduction surgery because their breasts are large and it starts to impact their life. Not only does it impact their activities, but it also impacts their bodies in the sense of having neck pains, back pains, their posture starts to go forward. Very difficult with clothing. Sometimes finding bras can be extremely hard to do. So breast reduction surgery is a way that a woman can improve their lifestyle. There are definitely different type of breast reductions that plastic surgeons perform. It has to do primarily with how large a woman is. And there are short scar techniques and there are long scar techniques. We are always going towards a short scar technique as much as safety will allow us. So I take time and explain to a woman which techniques are most safe. And if she's too large, a short scar technique is really not the best alternative. Because the one thing in this type of surgery, you don't want complications. You want to minimize them as much as possible. So the short scar or long scar technique really depends on the size a woman is on presentation and what she is trying to create in terms of her shape. And that takes some artistic talent on the behalf of the plastic surgeon to try to create that. The recovery for a breast reduction in general is fairly easy. In general, it should not be painful. It should not be cumbersome. It can be somewhat uncomfortable in the sense that things are tight and there's wounds that have to heal. There's drains that are placed in. There is care in that regard, but the early recovery is fairly simplistic. A woman usually will stay off work for a week to 10 days. By that time all the stitches are out, and usually by 4 to 6 weeks one can resume exercise. So in spite of the total healing process being 6 months or so, they're back to their usual normal activity at about 6 weeks, but back to work in about 2. These scars are always a concern of both doctors and patients, and this is the reason why we're going to more short scars opposed to more longer scars. The longer the scars are, the more chance for keloid scars, for hypertrophic scars. So we do a tremendous amount of care and post-op cares regarding scars. But as a general statement, women are so glad to have reduced breasts that the scars are a small price to pay for the change in lifestyle and the new freedom that they have in that regard. I think people would choose my practice for breast reductions because firstly I do a lot of them, so I have a vast experience in doing breast reduction. Also I have a large experience in doing short scars. They were first started in Europe about 10 years ago, and I started doing them as soon as they came out, so I'm through a lot of the learning curve of short scar work. So I feel very confident with breast reductions, and I can tell patients what they can expect in a very honest way. The other reasons why I think people come here is that I try to build trust in my patients. I try to build caring in my patients, and I think that stems through my entire practice and my staff. So patients come here, they feel very, very comfortable that they're going to be well cared for. The other thing is I feel that you have to be comfortable that the doctor is going to be there after the surgery as well as before the surgery, because complications do happen, and one needs to feel that this doctor is going to be there for my calls and any concerns that I have, and I take great pride in that. So I think that we offer some of the best care that any patient can find, and that's why I have my own team, so that I can control the experience from start to finish. Marin Cosmetic Surgery Center is a private surgery center that is fully accredited, and I choose to operate there because of the personalized service and the control that I can give to patients. I have my own team, my own anesthesiologists, my own scrub tech and nurses and recovery nurses, and patients feel like they're well cared for. Opposed to the hospitals, I've worked at hospitals all my life, and the care can be good some days, other days not as good, in the sense that you have different people every day, different anesthesiologists every day, different recovery people every day. So quality control is not consistent, in my opinion. I enjoy doing breast reduction surgeries primarily because patients are so happy afterwards. They're one of the happiest patients in cosmetic and reconstructive surgery. They come out of surgery and it's done. Immediate gratification. So it's a very rewarding for me as a surgeon to be able to experience that with a woman and share the excitement and the change in lifestyle.